invite Dr. Navneet Toshniwal for the next talk, Creating a New Standard in Cataract Surgery with Mono-More Technology, ICRIL CERT.
Good morning, everyone, respected chairperson and colleagues. We are talking on a monofocal, but advanced monofocal or more than monofocal. That's the topic. We are talking on this particular lens. Before going on a ICRIL CERT, I will just, in this figure we can see that what exactly monofocal IOL can give just for distance. And when we are using the multifocal IOLs, you can get some focal points, not the range of vision. This is very important. No need to get confused, because now monofocal we started with, then we started with the multifocal, then trifocals, and now every company is coming with this advanced monofocal or EDOF, extended depth of focus lenses. So here you can see these 3 points related to that. How to achieve this natural vision? This is very important word, and that is called as a continuous vision, not focal vision. And that means the functional intermediate. Now if you will see, most of our quality work we are doing, distance is a must for everybody, and then intermediate vision. That is, most of our job work is at an intermediate distance. That is very important. So this is already I explained that there is many terminology. It's a monofocal, advanced monofocal or extended depth of focus IOLs, we will see. Now this is another very interesting picture, that what exactly monofocal IOL can give at a far distance 1 point. Multifocal IOL already we explained in that figure, and 3 points, maybe it is trifocal or whatever it may be. Now this is very important nowadays, is the extended depth of the focus at intermediate distance, which is very important. And now why it is important? Because any case which is indication for monofocal, you can put it this advanced monofocal. That's very important. No need to check for many other criterias what we are taking in the consideration for multifocal, trifocal lenses. This is very important. To immediately we can jump in this practice of the EDOF lenses. Now you can see here what exactly these EDOF IOLs can give is the range of vision. That is the very important in this figure. Now many companies are coming with us, they are showing their specification. First thing what I do in my practice, I see the specification. How much is the 6 millimeter optic? Okay, 13 millimeter is the length. That is very, very important. That will give more stability in the back. Then other in 0 degree angulation. Then which are the formulas which we can use to put these lenses. Most important, many lenses are we have to load the lenses. One of the best criteria of this lens is it is coming in a beautiful preloaded system. That is very important. Again, what the KPS is hydrophilic acrylic, but this is the hydrophobic lens or hydrophobic acrylic. That is very important, because this is the material of choice nowadays. Then second thing which I do, we have to use that system. I just don't go on rely on any lens. We have to see practically we should use this. This is a very good preloaded system, very simple system. Just put some water, then viscoelastics, and there are some points. These are the fixed points. You put it plunger, that's all. And just after that, with a pen grip, with one hand, with good control on the eyeball, these are the clicking sounds, and you can put this IOL. So, although it works as if what we are putting in monofocal IOLs, you can see the good rings on that. There is no other different thing, but the stability you have to check, which we are trying to see on table. After this, putting the lens, how it looks like. 5 zones are, you can see clearly here, and you have to see the stability. That is very important. This is very unique feature. Now, once I am comfortable with the design, when I am comfortable with the loading system, then I start the study of particular IOLs. Now, in this, when I started the study of these IOLs, what is the best part, which I understand, there are the 5 zones. This is very important. You can see the picture in C2 and what exactly these are the 5 zones. These are very important, very nicely explained, these zones in their brochure also. Most important is the zone 1 and 3. If you will see, is giving the higher power for distance and intermediate. Why it is important? Because when you are going to get in at a zone 1 and 3 perfectly at a distance and intermediate this thing, it is a pupil independent. That is very, very important. What is the, in any scotopic condition, photopic condition, what is the pupil and all that, whether it reflects to your result. So that is the zone and 1, 3. 2 and 5 is having the nominal power as if a distance vision. And another unique feature is in a segment 4, which contains the higher power at 60-degree interval to balance the energy in photopic and scotopic. Again, this is for the pupil dependency and independency. Another very important criteria is the angle alpha and angle kappa. Whatever angle alpha kappa, just straightforward, as if you are putting monofocal, you can put these IOLs very, very safely. You can see the depth of focus here. It's a 1.75 diopter of the focus. This is a defocus curve. And this another very important figure, when you are going to see the difference between the MTF function, the contrast sensitivity of the IOL. You can see in the monofocal, it is at a top point, but it is giving just one focal point. In these cases, in advanced monofocal lenses, it is not like monofocal, but it is near to monofocal as in a contrast, and you can get the 2 diopter depth of field. This is very important nowadays in this EDOF lenses. You can see this contrast sensitivity up to the 2 diopter difference between the monofocal and this EDOF lenses. It is a better contrast sensitivity up to this particular range of vision. And this intermediate vision up to the 57 centimeter. In our practice, when we start these lenses, we do some combinations and all that. Either company may or may not allow, or it is not scientifically, but minus 0.5 diopter, if you will start adding in the other eye or like that, it will give still your zone, that 57 centimeter will come to the closer. In some of the studies, I have not done big study of the many lenses, 10 to 15 lenses, but at a 40 centimeter also it is a N8. Not very clear, but small refraction may be needed for that. But up to it starts from 40 centimeter, distance was a minus 0.5 diopter, it will give the nice range of the vision. I have a machine, this is the Tracy. I will definitely recommend those who are affording this machine, Tracy technology. This is one of the unique machine which will give you the idea of the quality of the vision. For many practice, angle alpha, angle kappa, then your contrast sensitivity, you can check the IOLs. Whatever IOL you will put put on this machine, you will get the idea. Here what you can see in this figure is this is the internal, this is the cornea, this is the internal. And this modular transfer function, you have to see after putting the IOL in the eye, you can check with this. If MTF is better, because if you compare the many lenses, especially in multifocal and trifocal, this will go down. But even in the advanced monofocal lenses, if you will compare the series of the lenses, you will get the different type of result. But here I got this type of results in a 6 to 7 patient. I have checked after 1 week, 2 weeks, and these are the very important results. This is the range of vision. Why intermediate vision is really needed. This is I have already mentioned. And as a clinician, now our 80 to 90% of the practice has gone for this EDOF lenses. Now many lenses are coming. Now monofocal toric, this indication has finished. Now it is the EDOF toric. Either you put EDOF, or if there is astigmatism more than one diopter, you can go for the EDOF toric. The results are extremely fantastic, and these are the two important choices of the IOL, a safe IOL practice once you do your job extremely well. We will particularly see this lens at a glance, good extended depth of focus, continuous vision, very fast neural adaptation. This is a very big difference than the multifocals and trifocal. Of course, glare halos can come, but there is a very minimal glare and halos. I have already mentioned about the pupil dependency set. Performance in all light condition is extremely better, and we have seen the aberrations also. That is the reason. So, in practice, whenever you can go with particular lens, first see the criteria. Second is the ease of the procedure, and then you start the study by yourself. You should not depend on the particular surgeon or this thing. They are giving the references, but you start using this thing, and once it is a customized everything, then you will start getting the advantage of these lenses. So EDOF, advanced monofocal, is the choice with all these very impressive points of this lens. This is one of the good choice in my practice nowadays. Thank you very much for your patience.
Thank you, Dr. Navneet, sir. You have been a genius from, I think, during our early days of practice. You are the one few person in India who was doing the cataract training, I think, way back in year 1995, 96 also. So as you said that, I think the trend should go towards for every patient, we should give the best of the best quality vision. I think monofocal is going to be come down, and most of us, that choice of lens is going to be the advanced monofocal or EDOF lenses. The lens which has got no rings on that, with a less glare and halos, I think there is going to be the